Good afternoon, and welcome back to Community Conversation with UI Cancer Center. I'm Mona Strahan, and if you are joining us for the first time in Community Conversation, it is a weekly show hosted by UI Health Cancer Center, where we highlight UI Health and community partners, cancer information, and our different cancer-focused programs and interventions. Our aim is to build around UIC Cancer Center bench to community model. We are to disseminate educational cancer and other health information to the community. Our guests today are Dr. Lisa Tussing-Humphreys, Director of Diet Behavioral Shared Resource, and Sarah Oleander, which will come on later. And she's the Assistant Director of the DBSR. They're here today to talk to you about obesity, healthy diets, and cancer risk. We start our conversation with Lisa. Good afternoon, Lisa. How are you?
I'm good, Mona. Thank you for having me today.
Very good. So, you know what? Why don't you just give a little bit more insight and let them know more about your background?
Sure. So, I'm a registered dietitian. I'm a nutrition scientist at UIC.
Okay.
I am the director of the Diet and Behavior Shared Resource at the Cancer Center. What that means is the Diet and Behavior Shared Resource was developed by the leaders of the Cancer Center so that we can work more to integrate lifestyle-related markers into the research that we're doing at the Cancer Center. And what I mean by lifestyle behaviors is I mean behaviors like diet, physical activity, as well as different factors related to our psychosocial health.
Okay, so that's more like a research kind of focus, isn't it?
It is more of a research focus, but DBSR does involve ourselves in community engagement activities with the Cancer Center. So just this past weekend, we were involved in the Hope Fest events. So we do take some of the research that we understand about diet and disease risk, particularly cancer risk, and help to bring that information to the community.
Okay, so did you get in contact with, so when you was at the Hope Fest this weekend, did you have any conversations with any other participants there?
So Sarah, who you'll talk to in a little bit, she did engage with several members of the community. She talked with parents about their child's health. She talked to parents about their health and specifically about how you can follow a healthy diet, more of a plant-based diet, and how that can help decrease your risk for several types of diseases, including cancer, but also how a healthy diet can help with their child's health, particularly maintaining a healthy body weight.
Okay, so Dr. Tussing just gave a brief information about plant-based diet, so we're going to go more into that when Sarah come on. So I'm going to ask a couple of more questions.
Sure.
So please tell us why your work is so important to the community of Chicago.
So the research that my team is involved in, so my research lab, a lot of what we focus on is how diet can impact your risk for colon cancer. So colon cancer is rampant in many of the communities around UIC. It is a cancer that's very much associated with lifestyle behaviors. So we've chosen to focus on diet, and specifically our research looks at how red meat and also how saturated fat impacts a person's intestinal health. And what we're interested in seeing is how when we feed a person a certain type of diet, how that impacts the type of bacteria or bugs that they have in their intestine.
You know what, some people get kind of confused when you talk about bacteria and kind of bugs. So what do you mean when you say bacteria?
So when I talk about bacteria, in our bodies and on our bodies, we have bacteria that live with us, and they can influence our health, and some bacteria are very beneficial to our health. Other bacteria, like an E. coli, if that flourishes in our system, can make us very sick. So actually what we eat influences the type of bacteria we have in our gut. So it can influence if we have more good bacteria or more bad bacteria. And that's what we're looking at. So we are trying to understand how red meat, which we know is associated with increases in cancer risk, particularly colorectal cancer, and how dietary fat influences our intestinal health. And we actually feed people diets to look at how these diets are impacting their health. So we give them all of the meals within the context of our study.
Okay, very good, very good. So many people have already probably heard about the word obesity, morbidly obese. Obesity can give us full classification of obesity. Could you give us a full classification of obesity? So I'm going to go here to our chart here. So
So what we mean by when we say the word obesity is really just an excess in body fat. And from a clinical perspective or in the healthcare community, what we're really interested in is the fat that's around your organs, or what we call central or visceral fat. Typically, clinically, your doctor might measure something called your BMI, or your body mass index.
Okay, so we'll go back to that again.
Yeah, and here we have a chart here. This is how we categorize people as being a healthy weight, being overweight, or being obese. So as you can see from this chart here, if somebody was like, if say on the left was 5'6".
Okay, so I'm going to 5'6" here.
Yeah, okay. And then if you look at their weight, let's say their weight was 200 pounds.
Okay, so let me go over here. So this is how we go across the scale here.
And you can see here that a 5'6", 200-pound individual, I think this is particularly I think this is men, but this person would have a BMI of 32.3, meaning that they would be in the obese category. So this is based on a BMI is based on a person's height and weight, and it's a crude marker of how much body fat you have. So for instance, if somebody was an athlete and had a lot of muscle mass, this would not be a good indicator of how much body fat they had, because it takes into consideration their weight, and muscle weighs a lot. But for most people, this is a good indicator of your body fat status.
Okay, very good, very good. So we had a BMI chart there. So I'm going to go back to the chart right quick again. And so right there, it's a really good source there. You can go to www.freebmicalculator.net in order to download the BMI chart. I'm pretty sure people have seen BMI charts for years and years, but this is a really great chart in which they brought in, and it's the color contents there, let you know underweight, normal, overweight, and obesity. Okay, how many people throughout the country do you know in terms of research are obese?
So recent statistics from the government indicate that close to 40%, between 35 and 40% of adults are obese. And when I say adults, I mean people that are older than 20 years. However, for older adults, the rate is much higher. So we see rates anywhere between 35 to 55%, depending on your racial ethnic category. However, when you combine overweight and obesity together, we see rates beyond 60% in the U.S.
Okay, so I have a caller. Okay, so caller, I'm going to answer the call.
Hi.
Hi, how are you?
I'm great. Apparently, I'm morbidly obese. I've looked at my BMI index multiple times. I'm fit, I'm trim, I go to the gym, I work out, I work every day, but my body mass index is on the overweight side. But I don't think anybody who knows me would say, oh, Jason's obese. So, I think, what is it that how is that thing, that chart, how does that really equate to real life bodies in the United States? And I'll get off the phone and let you guys answer my call on the air. Thanks so much.
Thank you so much for calling.
Thank you. So that's a really good point, and that's why I had mentioned it's a crude estimate of somebody's adiposity, or the amount of body fat that they have. And again, this is to be useful across a broad spectrum of people, and it's a kind of a quick and dirty way to estimate if somebody's obese or not. When you're, again, I use the example of an athlete, or maybe somebody that's highly active, BMI is not going to be necessarily a good indicator of their body fat. So we do have more sophisticated methods to examine a person's body composition. For instance, as you know, we use a body composition scan, or a DEXA scan, to get a better sense of how much body fat an individual has from a research perspective. I think more from a medical or clinical perspective, what we're finding to be more interesting is, again, how much body fat someone has in their central region, so around their organs. So measuring something like a waist circumference may be more indicative of not only how much fat you have in your central region, but also your risk for diseases. So BMI is, again, just a quick and dirty way to estimate, but it's certainly not going to work for every individual in terms of estimating their body fat.
Very good. So caller, there is help. No need to worry. There is help. So we got a couple of more questions here. because we're going to bring on Sarah Oleander in a few minutes. I think it did with Dr. Humphrey Tussings. How can obesity affect a person's day-to-day life?
So I think we're learning that obesity can affect an individual in a variety of ways. Mm-hmm. So as we've talked about a little, it can obviously affect the diseases a person has. And we know that many of the diseases associated with obesity, chronic diseases like cancers, diabetes, heart disease, they carry a significant burden, not only with taking medications, but it can affect how a person feels day to day. Another thing we're learning more about is actually how obesity and excess body weight can affect how your brain functions.
Oh, gosh. Okay.
And we're finding more that obesity, because of what obesity does to your body, it increases inflammation. Can also...
So when you say inflammation in terms of what becomes inflamed?
So your fat tissue actually produces chemicals that talk to other systems in your body. Okay. So when you become obese, your fat tissue starts to expand, and actually I would call it almost has some scarring to some degree. And it starts talking with your immune system more and more and more, and it starts producing chemicals that talk more to your immune system and to other tissues in your body. And this triggers a local but also systemic inflammatory response. And this inflammation can cause many diseases to develop, including cancers. And that's one of the hypotheses linking obesity with cancer.
So when you mean hypotheses, break it down a little bit.
So what I mean is it's very clear, and I don't want to get too technical, but in animal studies that inflammation can cause cancers. Okay. And we see in obese people higher rates of cancers, specifically what are called epithelial cancers, so like your colon cancer and your postmenopausal breast cancer. Gosh. So the link being this increase in body inflammation that an obese person has, and this is related to the excess adipose tissue and the chemicals that the adipose tissue is producing. Gosh. So getting back to the day-to-day, these obesity-related changes we're learning can affect a person's mood. So we see higher rates of depression in persons with obesity. We also see loss in cognition in persons with obesity, meaning that their cognitive status is declining sooner as they age.
Okay. All right.
Also, just from more of a mechanical standpoint, when you carry more body weight for long periods of time, it's going to have a lot of impact on your joints as well. So we see a lot with obese individuals, knee osteoarthritis, as well as a lot of hip problems.
Okay. Well, you know what? Well, that was the next question about what diseases. And then there was actually two questions you asked already. So how could obesity lead to cancer? But you are fabulous. You are so smart. She's brilliant. She really is. And I thank you so much.
Thank you so much, Mona.
I didn't know where else to put it on. So if you want to get any more information about Dr. Lisa Tussing-Humphrey, please, you can contact her here. She's at the University of Illinois Cancer Center. She's the Director of Diet and Behavior Shared Resources, and her number is 312-355-5521. Again, that number is 312-355-5521. It's L Tussings, Tussing, at uic.edu. Okay, we have a new guest. Let's go on over here. Okay, this is Sarah Oleander.
Hi, Mona.
How are you? And so, Sarah, tell us a little bit about you.
I, like Lisa Tussing-Humphreys, am a registered dietitian. I am the Assistant Director of the Diet and Behavior Resource for the Cancer Center. And I also am the President-elect for the Chicago Academy of Nutrition and Dietetics.
Okay, and one more thing that I'm really proud of, and what are you our president of? What else?
That's the Chicago Academy of Nutrition and Dietetics.
And for
Chicago.
Okay, yeah. Okay, well, very good. Okay, so we have a couple of questions to ask for you. So, Sarah, can you tell us what your work focuses on right now?
Well, I work with Dr. Lisa Tussing-Humphreys quite a bit, and in my role with the DBSR, I'm mostly the communications liaison. So what I do is kind of the communication hub between the researchers who want to integrate some sort of behavioral measurement into the research that they're doing. So they would reach out to me, and I would help them navigate through what kind of measures and what kind of experts they need to get involved with their study, and then help them with any training on data collection for their team, or help manage their data collectors who are hired through us that I supervise.
So you need data collectors for research. Am I correct?
Research, correct.
Okay, research, correct. Okay. So some of our audience may not know about the importance of a healthy diet, but can you describe to us the benefits of a healthy diet?
Sure, there's so many. Well, like Lisa said, there is reduced risk for a number of chronic diseases. But in addition to those benefits, it also can help provide weight control. It improves mood, increases energy, and overall just increasing the quality of your life. So it's not only increasing the length of your life, but the longer life that you're leading is going to be of more quality years through a healthy diet.
Okay. So I have on the slide called the American Plate. Want me to show that now?
Sure, we can show that now if you like.
And so I have a picture up here, the new American Plate. Could you describe it a little bit for me?
Well, sure. Like Lisa was talking about, is trying to have a healthy eating pattern with an emphasis on plant food. So the new American Plate comes from the American Institute of Cancer Research, and this is the healthy eating pattern that they're referring to, which is incorporating more plant foods into your diet. And you can do that very simply by trying to follow the eating pattern that's here on the screen with the American Plate. So it's increasing the fruits and vegetables and the whole grains that are on your plate to about 2/3 of the plate, and then limiting the protein to just 1/3 of the plate, and that can also include any low-fat dairy on the plate, and that's going to be your protein source. And I can go into a little bit more detail about choosing those if you would like to.
Okay, absolutely.
So in terms of cancer risk, when you're talking about your proteins, we do suggest limiting the amount of red meat that you're consuming for reduced cancer risk, and avoiding, to get altogether if possible, any processed meats. Those have been associated with increased cancer risk. So processed meats would be anything like bacon, sausage, deli meats, hot dogs. So the more manufacturing it's gone to before it gets to you is the processing. So those meats specifically are going to be increased risk for chronic diseases if you're continuing to eat them on a regular basis.
Okay, so for example, I love a hot dog. Love some bacon.
Sure.
Should I not eat it every day? Should I not eat it every day? Should I eat it once a week or twice a week?
So it's it's a fine balance to have to do that. You don't want to have to deprive yourself or cut things out so completely that then you feel like you're being so deprived that you're going to then go binge on something.
Yes.
So finding that healthy balance on most days, I would say, if you're somebody who's eating nothing like this new American Plate, the picture that we had up,
go back to the picture.
I certainly wouldn't suggest that you tomorrow switch everything you're doing and start eating that way. The best way to incorporate it is to make slow changes towards this. So maybe you do start first, just try to reduce the number of times a week that you're having your bacon or your sausage, or whatever your pleasure is, that guilty pleasure that is not healthy for you. So making a transition to something that is more healthy and making that part of your new habit. So maybe you're not craving it quite as much and you don't feel that same craving for it.
Yeah, okay, that's excellent. Okay, so you already gave us some tips on advice people can use for a healthy, well, you didn't, so I'm going to ask this question. What are some tips and advice people can use for healthy weight management? Because everyone struggles with their weight, and people go through the process and they go on these really fad diets and they just want to just lose all this weight. What can we tell people in the communities in which we serve is how to lose weight, and to lose weight in a very normalistic kind of way?
Well, I would say the first thing is to understand where your calories are coming from and having an energy balance. So, you know, the food we eat has calories in it. And if you're trying to maintain your weight, you want the amount of energy your body is using to equal the amount of energy you're consuming. If you need to lose weight, you want to have a calorie deficit, meaning the amount of calories you're taking in would be less than your body is losing, and then you're going to be using your fat stores, and you can achieve that healthy weight. In order to do that, I would say the first thing you should do is try to figure out where in your diet those high calorie foods are coming from. So becoming more accustomed to looking at labels and sort of identifying those high calorie, high fat foods in your diet, and then trying to, once you identify those, maybe making one or two changes. Like I said, slow, gradual changes to try and achieve that healthy eating.
Sarah, we have a caller. Caller, welcome.
Hello. My question is, well, first I'd like to say, bacon. The first question is, making those changes is difficult for most people. It's been difficult for me to really focus, make everything more vegetable oriented and less of the animal protein. But you said something that really stuck in my head. The deli meats are processed food. Now, I've always gone and got carved chicken, carved turkey, and I make sandwiches and stuff like that to bring to work with me every day. But is that the kind of the thing you're talking about, or is it really the head cheese and the pimento loaf stuff? I mean, what exactly are you talking about with deli meat? So
even deli meats are processed, and they're also going to be very high in sodium. So if you want to have sandwiches, if you can try and get like the actual sliced chicken breast, like off of a roast chicken, that would be preferable to something that's going to come already prepackaged and sliced and then given to you.
And if you've been to some of the delis around here, it'd probably save us a lot of time too. They're so slow. Thanks so much for taking my call.
Okay, thank you for calling. Thank you. Okay, well, thank you. That was very, very helpful. I've got some more questions here.
Okay.
What does one diet relate to the risk of chronic diseases, including cancer? And I know Dr. Humphrey, she went over a little bit, but I want you to go a little bit more.
Oh, what other conditions?
What other diet related? Yes.
Sure. So for sure, hypertension. Heart disease, dyslipidemia, so high cholesterol. As well as can even diabetes leading to chronic kidney disease and other problems, as well as the cancers that Lisa talked about. Okay. What are some recommendations you may have for people transitioning into a healthy diet? And I know you gave some information, but just... Sure. So what we talk about, and one of the ways that I was talking about earlier, is making those small gradual changes. We can do those through making SMART goals, and I think I sent you
did. Let me go to
a picture for that.
No, not that one. Okay. SMART goals. All right. Let's pull it up on the screen here.
So like I said, you don't want to go too quickly on changing to a new diet. So if you can make your changes specific, measurable, achievable, relevant to your goal, and then time bound, so giving yourself a deadline to achieve those, and maybe only making one or two at a time. Okay. Well, hey, we have it all together here today, and we had two excellent guests here, Dr. Lisa Tussing and Sarah, who gave some excellent information on how we can better service ourselves in terms of eating a healthier diet and getting ourselves together. So I really like to thank you guys for tuning in today. And for more information, let me push over here again. You can contact University of Illinois Cancer Center, Dr. Lisa Tussing-Humphrey. She is a registered dietitian nutritionist, director of Diet and Behavior Shared Resource, and you can reach her at 312-355-5521 or ltussings@uic.edu. And I want to thank you for
tuning in to us today.
You done?